Hello friends, welcome to the next episode of the Vlogging Orthopod. Today we have a very special guest with us, Dr. Jae Chul. He is a neurosurgeon trained in Korea and now works as a spine fellow. And we are very lucky to have him here. I'm going to ask him the most common questions that you guys have about being a doctor in South Korea, and he will be answering all our queries today. Let's speak to Dr. Lee Jae himself and ask about various questions which we have for him. So, Dr. Lee, can you please introduce yourself first?
Okay. Hi guys, I'm Jae Chul and I'm your surgeon in Korea. It's nice to see you guys.
So, can you tell me which medical school you attended?
In Korea, there's 6 years of medical school and 1 year of internship and 4 years residence in university hospital.
Okay.
And for guys, there is 3 years of military service.
Oh yes,
Yeah.
that is very
Quite
good.
long period.
Okay. So, which university did you attend? The name of the university?
My university.
Mhm.
I graduated Chungnam National University in Daejeon, and I trained the medical residency in Samsung Hospital.
Oh, Samsung Medical Center. Yeah. So, so the next question for you is, how is the medical? Is becoming doctor a very prestigious thing in Korea?
It's a little complicated in these days. I don't think it like that.
Mm-hmm.
As usual, yeah. As more as like other countries,
Yes, yes.
most of countries there is.
So doctors are very respected in Korean society.
I'm not sure.
Okay.
I want to consider all that, but in this day we have a strike
Ah.
2 years ago.
Okay.
The young doctors have a strike, so
Okay.
it's really difficult in these days to say yes.
Oh, okay.
Yeah, but I'm proud of my job.
Job.
Yeah.
That's great. That's great. Do doctors in Korea make a lot of money?
Yeah, I think so. Yeah.
Okay. So what?
Other than other job, but the training
Yes.
system is really wrong.
Yes.
So it has pros and cons.
Yeah. So you invest your years into
Yeah.
training.
More than about 15 years.
Yes.
So
Yes. So obviously it has to pay you well because you have invested so much of your time in this.
yeah, and
learning.
for now I have too much time.
Mm-hmm.
Yeah, than other job, office job or
Yeah.
Sure.
It's not a typical 9 to 5 job. It can extend any day. You might have to wait for
Yeah.
more time, something like that. Okay. And how are the working hours and work-life balance in Korea for doctors?
The work-life balance is can
Yeah.
sucks.
Yeah, definitely. No.
Work-life balance is really not good.
Not
yeah,
good.
it sucks. And working hours also, we don't have official working hour, as you know.
Mm-hmm.
Oh, we started at about 7:30 a.m. and we finish when the surgery or the work is finished.
Yeah.
And in university hospital, yeah, it is worse than
Worse
that.
than
yeah.
this. Oh, okay. So guys, you should take a note of this. You see, doctors earn money and they are respected, but at the same time, they have to go almost 15 years of training in Korea, and the work hours are not fixed. You will be working almost 12 hours a day minimum in a private hospital, and in a university hospital, it can be even harder than this. So let's move to the next question. Would you like to visit other countries for fellowship, etc.? Like I have come here from India.
Yeah.
So do you want to go to some other country to explore new things, new techniques?
I did really so much. Especially, I really wanted to go to USA
Mm-hmm.
in my the medical school
Mm-hmm.
days. But there's a lot of limitation in Korea,
Okay.
especially for men, because of the military
Military
service, and uh, we don't have the culture of to
Go
we
to
go
other
to other countries to have fellowship. Yeah,
But-
it's really difficult.
Mm-hmm. But if you are given an option or chance to visit other country, you would like to go to the US
For now,
now, or
I'm too old for that. But if I go back, or if I have an option to not have military service, I
Oh,
would
that
want
would-
to. Yeah.
Mhm. Because it takes 3 years of your life, the military service,
Yeah,
so that is a
it's
bit
too
tough.
long.
Yes. And overall, are you satisfied with the situation as a doctor in Korea?
It's a little similar for the previous question,
Mhm.
but I'm a little sad about this situation of the doctor thing in Korea,
Mhm.
because the government I don't like,
Mm-hmm.
and don't support of the thing.
So
I think so.
okay. So what if tomorrow I like if you have an option to go back in time and you become 18 years old again and you have a choice to choose your career, will you still choose to become a doctor?
Doctor? Yeah, sure. Yeah. No,
And would you
all the thing that I complain about the doctor thing, but I'm really proud of my job, and I'm glad to have the to become surgery.
yes.
Yeah, surgeon. As you are.
Yeah.
Yeah.
So if you were to choose the branch, you will still choose neurosurgery again, or some other surgery, whatever.
I yeah, I think so.
You still
Yeah.
yeah.
I'm a little concerning about become orthopedic doctor.
Mhm.
Orthopedic doctor is really
Yeah, so ultimately I am orthopedic, we ultimately do spine surgery, so it is, yeah, it's a good field. Yeah. And what do you think about doctors who are living in other countries and they want to visit Korea to do some training, to learn in a medical school? Because Korea has become very popular in last 10 years because of the K-drama and the pop culture. And there are some hospital related dramas as well, and people see it and they are really want to come to Korea. What is your opinion?
For me, you are the first foreign doctors to training
Yes.
Korean
Okay.
medical things. So we all, I think, we the fellowship all a little awful,
Mm-hmm.
yeah, to treat foreign doctors
Mm-hmm.
from other countries, and Koreans still little being that
Not
the
that
social
open,
social country,
Yeah,
we don't use English as a common
Mhm.
language, and but you're all welcome.
Yeah. So I think what I have observed is Korea has a great hospitality. So whenever I visit, like in my experience, I have never been treated badly. Always everybody has helped me in all my problems. Personally, Korea has been a very great experience. And although one thing I would want to stress that you need to learn Korean if you are really planning to do something for a longer period of time in Korea, because if you don't know Korean, you will not understand. First of all, you cannot communicate with patient, and the other thing is even for day-to-day communication, learning Korean language is very important. So I think those who are planning for a long-term thing in Korea it's a must that you should know Korean, right? If you want to survive in Korea. Yeah. So thank you so much, Dr. Lee, for your time. And
I'm sorry for my bad word, bad English. So.
No, that's all cool. And I'm sure my viewers will really like you, and the very fact that you gave this channel an interview. Thank you so much.
Thank you.
Thank you so much.
Thank you so much.
Actually, we are doing interview for my YouTube channel.
You have a YouTube channel?
Hey, would you like to join?
How many?
Subscribers?
Yes.
2,800.
200?
Like 2,800. Would you like to join?
Ashin?
The vlogging orthopod.
What?
The vlogging orthopod. Vlog.
Send me the
Yeah,
address.
Would you like to join? Like
No.